Are you one of those who is suffering from leg pains day in and day out? The pain just doesn't seem to go away. And probably you're wondering that, it's a part of your hectic schedule, maybe a part of aging. But let me tell you that there are multiple reasons for leg pain. So stay tuned in, because I'm going to give you 3 self-checks as we move along, so that you know what is the reason behind your leg pain, and also whether you should be really worried about it and get yourself checked by a specialist. Our body tissue, our leg tissue, is made up of muscles. There is something called as nerves, which gives sensation. There is something called as arteries, which bring pure blood from the heart to the legs. And also we have the veins, which take the impure blood back from the legs to the heart. Now the leg pain can be a result of a problem which is affecting any of these 4. For example, you have a pain which is like, aching sort of a pain. You get on sitting for long hours or standing for long hours, but then you get up and you move around a bit, then it's more likely to be a muscle pain. On the contrary, if you have something wrong going on with your nerves, then you will have a prickly sensation near the toes, in the legs, and sometimes this nerve pain can radiate right from the back along the leg, and this is called as shooting pain, what we refer to as. If the pain is due to involvement of arteries, the arteries can get blocked as we age. They can get blocked in diabetes. Then this particular pain is very classical, in the sense that as the patient walks, as the person walks, the pain tends to appear in the calf, in the legs, and it makes the person stop because there is poor blood supply. The patient stops, the person stops, starts walking again, and the pain just seems to go away. And again it comes back. So this is known as claudication pain, and it is very classical of the problem with arteries. Coming to the very important problem with the veins, what we call as the varicose veins, the pain is more of a discomfort, which is more towards the evening, and there may be even swelling associated. The swelling is near the ankles, and both this, the swelling as well as the pain, it tends to disappear on limb elevation. The classical thing which my patients tell me of varicose veins is that their swelling is absolutely gone, their pain is absolutely gone in the morning, and it only appears as the day progresses. So if you are someone who is involved in a profession wherein you have to stand for long hours, and your legs start aching, they become sore towards the evening, and you have difficulty in doing the movements, you touch that part of the leg and you have sudden pain, then this particular pain is more likely to be related with muscle or soft tissue. You do a bit of stretching, maybe sitting at the same place, you take rest for some time, and this pain tends to go away. Then definitely there are chances that it is related to muscles, underlying muscles, and you needn't really worry about it. Probably you are just overworked. Now imagine that you're sitting in your office, a desk job, continually for 4 hours, 6 hours, and one fine day you suddenly have a shooting type of pain, fairly unbearable, which starts from your back and goes down your leg. And along with that, you have some tingling sensation, some needle prick sensation towards the lower part of the leg. Then this is more likely to be related to your nerves. Nerves are the structures which help us sense. They offer us sensations, various sensations. Also, they are the ones which offer power to our muscles. So if your pain is a shooting kind of pain, it is a burning kind of pain, which is associated with needle prickly sensations, then it is more likely to be related to your nerves, and it requires a different kind of evaluation than what a muscle problem would demand. Now, if you come across someone who is telling you that he or she is unable to walk for a short distance, they have to stop after walking for a short distance, then this particular type of pain can be related to arteries. Now, arteries are blood vessels which bring pure blood from the heart to the legs, and with advancing age, in diseases such as diabetes or even those who have high cholesterol, the arteries tend to get blocked. And once they get blocked, the blood supply to the muscles is affected. So such a person, when he or she walks for a short distance, the blood supply isn't sufficient to the calf muscles. They get pain, which is fairly severe. They have to stop. This is known as claudication pain. The person rests for a while, the pain goes away, and the person can walk again. So this is very classical of an arterial problem and definitely needs to be evaluated at the right time. Now we come to the fourth common type of pain, and that is related to veins. As you are aware, veins are the blood vessels which bring impure blood back from the legs, or which carry impure blood back from the legs to the heart. Now, maybe you have come across an elderly relative, maybe your neighborhood shopkeeper, maybe teacher, an office colleague, and they tell you that their legs really ache badly towards the evening. You have a look at their legs, you suddenly see bulging, twisted structures, veins on their legs, maybe some pigmentation, some darkening of the skin near the ankle, and voila, that is basically due to the veins getting affected. The pain due to varicose veins is very classical. The pain is absolutely not present in the morning hours. The patients are absolutely fresh. But as the day advances, the calf, they tend to get heavier. And it only increases as the day advances. They even tend to have nocturnal cramps. But in the morning hours, they're absolutely fine. So if you have anyone, you have come across anyone who has such varicose veins and pain related to them, it's very important that they get evaluated at the right time. So there are certain checkpoints that you can do yourself to know what kind of pain, leg pain that you're suffering from. If you have a kind of pain wherein your legs are aching, you touch that part of the leg and the pain increases, then it is most likely to be due to soft tissue. If the pain is such that it is associated with tingling sensation, pinprick sensation, or it is shooting kind of pain starting from your back going to the legs, it's most likely to be due to your nerves. If the pain is such that one is not able to walk for a long distance, has to stop, the pain goes away, it's due to your arteries. And if the pain is more towards the evening and is associated with swelling, and both of them decrease, they reduce on lying down, leg elevation, and is absolutely normal in the morning, then it is due to your veins.